So good afternoon, everyone. We might get started then. If you have any audio issues or anything, just send us a message and let us know. So welcome, everyone. My name's Alison Alari and I'm from Injury Matters. I would also like to introduce Sonia Clark, who is also a physiotherapist from Injury Matters, and she will also be presenting today. So before I get started, I would like to show my respect and acknowledge the traditional custodians of this land and of the elders past and present on which this event takes place. If you have any questions about anything that we discussed today, please send your questions through and we will answer all of them at the end of the presentation. So Injury Matters is a for-purpose, not-for-profit agency leading the way in preventing injuries and supporting recovery in Western Australia. Our aspiration is that all West Australians live a life uninterrupted by injury. We do this through the provision of injury prevention programs and services. So we achieve this through the delivery of our 3 core programs: Stay on Your Feet, Road Trauma Support and No Injury. So No Injury is provided by Injury Matters and funded by the state government through the Department of Health. So No Injury aims to enhance the capacity of people and organisations to deliver evidence-informed injury prevention and community safety activities. So No Injury provides training, resources and a website. So No stands for knowing about different types of injury. Learning is about learning about injury prevention practice. We do this through providing training around a public health approach to injury prevention, which is surveillance, determinants, interventions, implementation and evaluation. And the Connect is about connecting with other people and agencies conducting injury prevention around WA. So this can cover a range of issues such as burns and scalds, drowning, poisonings, road trauma, or even falls prevention. So before we get started, what is injury? So injury has been defined as either intentional or unintentional harm to a person resulting from contact with an object, substance, or another person. This can be either through excessive energy or the sudden absence of vital elements such as oxygen. So it can also be described as a mental harm, suffering, damage, impairment, or dysfunction caused to a person as a direct result of some action, perceived threat, or failure to act by some individual. So a bit of a snapshot of injury in Western Australia. In 2012, there were 227,000 injury events in Western Australia. This includes emergency room visits, hospitalisations and deaths. The costs were calculated based on health sector costs, which includes long-term care needs, loss of productivity and a loss of quality of life. So all up, there is about 93 injuries per 100,000 people. So to look a little bit more specifically about older adults, when we're talking about older adults as well, throughout this presentation, we are referring to people aged over 65 years. So older adults account for about 30% of all injuries at a total cost of $9.6 billion. Similar to the previous slide, these costs were calculated on health sector costs, long-term care needs, loss of productivity, and loss of quality of life. As you can see from the table on the right, injuries in older adults are more serious than the rest of the population, with far more fatal injuries and hospitalisations compared to presentations at emergency departments. So the number of injuries by mechanism for older adults, as you can see in 2012, older adults had around 8,377 falls fatalities and hospitalisations. So falls injuries were substantially higher than all other injuries for older adults, highlighting why this is such an issue for this age group. So the cost by mechanism, drowning injuries and self-harm cost more per injury. However, when you look at the percentage share of total costs, falls still make up a large proportion due to the high number of injuries in this area. So this slide shows you the falls injury rate for both the Aboriginal population and the non-Aboriginal population. As you can see, Aboriginal people will have much higher rates of hospitalisation and emergency department attendance for fall-related injuries when compared to non-Aboriginal peoples. So West Australia has a rapidly ageing population and is facing significant demographic changes as a result. So in 2016, there were just over 478,000 people aged 60 years and over living in the state. By about 2021, this number will reach nearly 590,000, and 1 in 5 West Australians will be aged over 60 years. This is predicted again to rise again to 1 in 4 by 2050. So we know injury in older adults can have devastating outcomes, but the good news is that injuries can be prevented, and we know that there is lots of things that can be done, and as the population in WA continues to age, we will need to be innovative in our approach to injury prevention. The great thing is that age-friendly communities are communities that prevent injury. So I'll now pass you, So what does a fall mean to the older adults? So we know that the outcomes for older adult injuring themselves are not the same as other populations. Depending on the nature of a fall, a younger person that slips or trips can often recover if they have good balance, or they may recover quicker if they do have an injurious fall. For an older person with declining bone density, a fall can often result in fractures and time spent in hospital. Unfortunately, the nature of injury in older adults can result in premature death or early admittance to residential aged care. Loss of confidence and independence to do everyday activities can result in exuberating outcomes such as social isolation, increasing frailty due to lack of mobility or physical activity, which can put people at an increased risk of further falls. So now I'll pass you over to Sonia Clark, who will be talking more specifically about falls and falls injuries.
Hi everyone. Before we go on, we're just going to talk a little bit about falls in particular. Often falls are just considered accidents. However, they're often an interaction between three things. They don't just happen, they happen for reasons. They occur often as a result of a mismatched interaction between the person and obviously their individual capabilities, the environment that they are in, and obviously the requirements that that has of them. And this is further influenced by the activities they're involved in. Usually the reason why people fall can be classified into two categories. They're personal, or what we call intrinsic risk factors, and also environmental risk factors, or otherwise known as extrinsic risk factors. These two categories can be broken down further into more specific concerns, as you can see, which address both biological, demographic, and environmental factors, as well as some of the behavioural factors related to people's own risk factors. There are obviously some risk factors that we can't change. We can't get any younger, and we can't change the number of times we've fallen, or even who we are as a person in terms of our gender. However, there are modifiable risk factors that, through the right interventions, can lower a person's risk of falling by either reducing or minimising those risk factors. In addition to some of the risk factors that we've just considered, the natural aging process produces some changes in our body as we grow older. But these changes don't necessarily mean that we lose our balance, or we lose our mobility, or even that we have a fall. So let's look at some of those changes that are particularly relevant to us staying active and preventing falls. The first thing we look at is muscles. So muscle strength and power decline from around about age 40, and this accelerates further around about 65 to 70. Changes occur in the type 2 fibre muscles, and this can also result in a change or a decline in the size of the muscle, which can impact on our muscle strength and power. The other thing too is our lower body strength tends to decline at a faster rate than our upper body strength, and our power declines at a faster rate than our strength. So why is this important? Well, deficits in our strength and power can also be a predictor of disability in old age. In relation to falls in particular, strong and powerful muscles, in particular in our legs, are required to respond to help us regain our balance after a trip or a slip, so we can stop ourselves from falling. Next thing we'll look at is gait and mobility. So there's some sensory, motor and cognitive changes that happen as we get a bit older, and these can change the biomechanics of our everyday movement, like sitting, standing or walking around. And these changes, added to some of the environmental constraints, can adversely affect both our balance and mobility. Some of the changes we might see as we're aging, in particular in our walking, is our walking speed. We might have a shorter stride length. We might have a longer double limb support duration, and also we might have greater variability in our gait. And these age-related differences are often exaggerated when our balance is upset or perturbed. So these changes can impact on how efficiently we walk around in our environment. For instance, we might shuffle, shorten our steps, or perhaps take more uneven steps. And these are all important factors when we're trying to stay on our feet and prevent falls. Next thing is our joints and bones. As our bodies change and age, we lose some of the lubrication and the space in our joints. And this can impact on the flexibility of our joints and increase our risk of injury, as well as impact on the efficiency of how we move around. For example, our ability to lift our foot to clear an obstacle is important when we're negotiating challenges in our environment. Reduced ankle movement can also affect the stance and the swing phases of our gait. And as our bodies change, our bones can also become weaker and more brittle, making us more likely to fracture a bone if we do fall. Many of us may be aware of some of the changes we experience as we age, and in our vision in particular. It might become a little bit harder to read in poor light, or adjust our vision to a change in light, or even just the clarity of our vision. So we rely quite heavily from the information we get from our sensory system, in particular our eyes and also our joints, to make us manage our balance more effectively, as well as make predictions of the obstacles in our paths. Decreased vision and proprioception can impact on our ability and confidence to move around both in our own environments and also in unfamiliar environments. In relation to our balance systems, we often rely on our balance to stay upright when we overreach or when we trip over a pavement on an uneven surface. As we grow older, our postural sway can increase and our lateral stability as well. This can impact on how stable we are when we stand and how far we can reach in different directions. As we age, our reaction time and postural responses also slow down. So this makes it much harder to regain our balance in time, especially if we're rushing. So impaired balance can also increase our risk, our fear of falling, and this can obviously mean that we reduce our activities every day. And then with relation to our motor control, as our reaction time changes as we get over, it gets a bit slower, actually about 25% about 25% in our 60s compared to our 20s, as do our reflexes. And this makes it harder once again to regain our balance, especially when we're rushing. The speed of simple and repetitive movement slows down, and we're less able to control movements that require more precision. This is more noticeable when we're doing complex tasks. And when we're trying to dual task, for instance, do two things at once, we might walk and talk to someone as we walk. As we grow older, our ability to dual task and maintain our balance can also be challenged, requiring us to be much more vigilant about how we carry out things. What we do know, however, is that physical activity can counteract any of these age-related changes that happen, in particular to our muscles in terms of strength and power, our joint flexibility, as well as our gait. So what risk factors can be helped with exercise? Well, we know we can strengthen our legs. Clearly, we can't change how old we are, but we do know that falls are preventable. And by understanding what puts us at risk can help us to take action to prevent falls. So as we go through the risk factors that can be helped, we know that all of these can be addressed through physical activity and exercise. Okay. So why is exercise important to older adults? We've talked already about some of the age-related changes that happens, as well as some of the risk factors for falling. Physical activity is a major contributor to successful aging. It's widely known that regular practice of physical activity can have health benefits for everyone, including for older adults. And it clearly helps for preventing falls, as demonstrated by many of the studies that have been done. Many improved and well-being outcomes have been shown to occur with regular physical activity. These include helping us to maintain and improve our physical function and independent living, improve our social interactions, quality of life, and reduce depression, build and maintain healthy bones, muscles, and joints, reduce the risk of injuries from falls, also to reduce the risk of heart disease, stroke, high blood pressure, type 2 diabetes, and some cancers. To summarize, it contributes to a healthy and independent lifestyle, improves function, and enhances quality of life. However, despite all these benefits, there still seem to be many older Australians that aren't exercising. In a recent survey, they actually surveyed that 1 in 4 adults over 65 were reported that they were doing no exercise at all. So let's look at some of the barriers to exercise. One of the things is the whole lack of awareness, I think, despite a lot of the publicity and information out there. A lot of older adults too have competing time demands. Some of them have a lack of motivation and in a lot of cases a confidence to exercise, the way they perceive exercise. There are some older adults who have poor health status or may have an existing injury which prevents them from engaging in exercise. For a lot of people there's a negative perception of exercise as well. It's one of those things that's for other people who are more well or younger than me. One of the stated barriers also is poor access to exercise, and that's not just that there are not things around to exercise at, but also that there's not access to appropriate exercise for them or that they perceive as appropriate. Also a lack of facilities to exercise in and a lack of transport. We do know that people with lower socioeconomic needs actually are less likely to exercise as well. So cost is also a barrier to a lot of people exercising. It has been suggested, however, that the following motivators may help to encourage more active participation in physical activity. One of the things is for people to understand the relationship between physical activity and health. Another motivator might be an affordability. So some people might find if they've prepaid something, they might be more motivated to go something as well, to do some exercise. Other ones might see that if there's an incentive connected to it, that they might exercise as well. One of the motivators, of course, was for people to have safe and appropriate venues and programs, to often attend, I guess, a specialised gym that was more for people that they term more for seniors, where someone would understand their needs and that they'd been encouraged by people who are knowledgeable. Having a specific choice around what exercises they did, what they chose to do, and exercises that met their specific needs. Obviously, another motivator would be to be able to get into the facility or to the exercise area, and as well as having good transport options to get there easily. So what are the recommendations for older adults? On this table, it illustrates the recommendations from throughout the world that older adults are encouraged to follow when engaging in physical activity. While there are slight differences around specificity and quantity, the recommendations focus on 4 categories of physical activity types that can achieve improved health, independence, and well-being in older adults. These components are often affected during aging, and contribute to age-related functional decline, and should always be key components of any older adult program. So endurance, or aerobic, what we'd often call aerobic capacity, there's a major emphasis on increasing the demand on the hearts and lungs, and examples might be walking, cycling, riding, or in some cases jogging. Strength and resistance, where there's an emphasis on building muscle strength. This may include resistance exercises like lifting weights, stair climbing, or even weight-related resistance exercises. And then balance and stability, so both standing and moving around, where there's an emphasis on balance during walking, turning, going up and down steps, and any other mobility functions, as well as balance while we're standing. And then also flexibility and stretching activities. So why are these components important? Well, regular strength exercise, as previously discussed, limits age-related muscle decline and atrophy, while aerobic exercise has been associated with reduced cardiovascular risk and a decline or a better control of chronic disease. Balance exercise have also shown to significantly reduce falls risk and improve dynamic balance, as well as the fear of falling, which often contributes to older adults limiting their activity levels. And then flexibility exercises improve the joint range and muscle length required for these functional activities. Of course, while we consider all these things, we also consider some of the specific adaptations and modifications together with all these components to improve physical health and functional ability, and ultimately, of course, quality of life. Okay. With regards to falls-specific exercise, there's now extensive evidence to demonstrate that many falls are preventable, with exercise playing a crucial role in preventing falls. It's been suggested that exercise reduces falls rates in community-dwelling people by 21%, and a reduction of falls rates of 39% as a result of exercise programs that challenge balance and involve 3 or more hours of exercise a week. Of particular importance are lower limb muscle strength, gait, and balance, all of which can be improved with appropriate exercise. It is suggested that balance should be progressive, ongoing, and a sufficient dose. We are lucky enough to have had substantial studies done in the area of falls prevention. A group of people have collated some information with recommendations on what a falls prevention program should include. These were done by someone called Sherrington in 2016. So if you look at the key areas highlighted, the falls prevention program should include a high challenge to balance, 3 hours of exercise each week, should include both strength and training and some mobility. This should be ongoing so we can maintain the gains of that exercise. And what is particularly important too is that we should be targeting the general community, not just the people who have an increased falls risk. And obviously, if they're people with specific needs, they need to be dealt with particular expertise as well, and referrals made to particular health practitioners for that. Okay. There are a number of evidence-based programs that are shown to reduce falls. At Injury Matters, we run Train the Trainer programs throughout the year, and these are available to health and fitness professionals to develop their skills to facilitate these in the community. So the Otago program focuses on strength and balance, and it's been used in a variety of settings. And this program's been tested and shown to reduce falls in older adults living at home, and particularly those over 80. The program includes 5 strengthening exercises and 12 balance retraining exercises and up to 4 levels of difficulty. It also includes advice on walking. So the strengthening exercises focus particularly on the knee flexors, the knee extensors and hip abductors, which are important for mobility and function. Balance exercises are progressed from holding on to independent support, and focus on dynamic rather than static balance to help balance and recovery of balance. So the other one is the LIFE program, and this approach takes on everyday activities and tasks and turns them into opportunities to challenge your balance and improve strength, and teaches the older adult to embed these into their daily routines. With life, you don't do a specific set of exercises several times a week, but you rather grab simple tasks in your everyday and use them as an opportunity to challenge balance. So, for instance, taking socks from the drawer provides an opportunity to bend and straighten your legs. It's designed for older people who are at a risk of falling, with the aim of reducing falls and improving their function. This program is individualised using the Life tool as an assessment tool and has 5 levels of difficulty. The next one is Tai Chi for Arthritis and Falls Prevention. This was developed by Dr. Paul Lam at the Tai Chi for Health Institute and utilises the Tai Chi Sun style for its ability to improve relaxation, balance, and its ease of use in older adults. The movements are taught to both left and right sides and with turns to move forward and backwards and improve mobility, as well as offer a variety of combinations. Movements are performed at a higher stance to make it easier for older adults and those with arthritis. Movements can be modified to accommodate mobility issues for any participant and can be done seated as well as standing. So Tai Chi for Arthritis and Falls Prevention has been proven to improve balance, improve muscle strength, improve mobility, flexibility, improve psychological health, decrease pain, and most of all, prevent falls. The last one of the falls prevention programs is the Stepping On program, and this is an evidence-based program that's effective in reducing falls in older people living in the community. The program incorporates strategies to implement positive lifestyle changes and keep you independent, upright, and active. This program is said to reduce falls in 31% of people in the community, but it isn't really suitable for people with memory problems or neurological problems. There are also existing programs in the community that you may already have in your facility or be familiar with, and they all incorporate components of strength, balance, aerobic fitness, and flexibility. In addition to this, there may be many different ways that people can stay physically active, including in these might be leisure pursuits that involve physical activity, including golf, tennis, bowls, swimming, and various types of dancing. For example, ballroom dancing. We have developed a number of flyers at Stay on Your Feet which highlight the exercise benefits and the components of different leisure activities that older adults may be involved in or like to get involved in. I'm going to pass you back to Alison, who's going to address the topic of age-friendly communities and explore opportunities that are available.
Great, thanks, Sonia. So, what is an age-friendly community? So, an age-friendly community is about becoming a community that means working towards a better social and physical environment to create a better place for people to grow old. So age-friendly communities are those that are inclusive and accessible for people of all ages. This encompasses spaces and places and programs or initiatives that make a community better for all residents, from children and young people to older adults. Age-friendly communities benefit everyone by creating a culture of inclusion enjoyed by people of all ages and abilities. So these communities recognise the great diversity amongst its members, promote the inclusion and contribution on all areas of community life, respect their decisions and lifestyle choices, and anticipates and responds to age-related needs and preferences. As Australia grows and the population continues to age, the challenge will be our ability to meet the growing need for aged care and services. With this in mind, recreation centres can have a role to play in creating age-friendly communities by providing programs and services that allow older adults to age actively and that encourage older adults to develop and maintain their physical health. So how to make your recreation centre accessible. So recreation centres need to be low cost. Older adults can often be on pensions and not have a lot of spare income, so low cost programs, centres that are environmentally friendly. So I guess they're easy for older adults to access, and for them to be able to access them safely. So not a lot of stairs, and I guess not too far from the car park to get inside, and other things like that. Programs that also include a social component. Quite often older adult, that can be one of the biggest drivers or motivators, as Sonia discussed, for older adults to attend, so including that social part. Transport to and from the venue. So quite a few older adults won't drive, so is there public transport routes available close by, or carpooling systems in place, or is there a community bus that can pick them up and drop them off? Competing demands. Older adults might often have appointments, they might be ill, or have other, I guess, chronic illnesses that prevent them from coming to classes sometimes. And the final one is messaging and communications. So is your communications messaging and your, I guess, your communications at the recreation centre age-friendly and suitable for older adults? So the benefits for your recreation centre, some of them include supporting your local ageing community. You can possibly see an increase in traffic and participation, increased profits in business. There are many social benefits, and it's about creating that sense of community. I guess with more people coming through the door, there's the potential for increased scheduling and class options. And also, I guess, contributing towards a healthy ageing community, and also the potential for partnerships, particularly with allied health services in your area. If you are going to be running strength and balance programs for falls prevention, you could work with your allied health services and potentially get them to refer potential clients that they might be working with who are at a greater risk of falls. So I'm going to look now, look at a few case studies of local governments that have delivered or implemented either strength and balance falls prevention programs within their recreation centre. So the first one is the City of Armidale. Back in 2015, they, with the help of a Build Your Balance, Stay Feet Build Your Balance grant, they implemented a program called Easy Movers. So Easy Movers was a 10-week strength and balance program. It involved 3 sessions per week, with participants being reviewed at midpoint. And the program ran for 10 weeks. So following, I guess, post-program, there were reports of social as well as physical benefits, and participants were also able to move from the Easy Movers classes into the mainstream classes at the gym, and then new participants were also able to register. So the Easy Movers program was awarded the WA Health Excellence Awards for promoting healthy habits and preventing illness and injury in 2016. The pilot program was free, but they now charge a once-off fee, which is $65, which includes a pre- and post-assessment with an exercise physiologist. The program has been so successful that it is now being piloted in the neighbouring town of Denmark. Another local government, which also developed a strength and balance program for falls prevention, was the City of Greater Geraldton, who came up with the program Balance Gym. So the program is a low-intensity strength and balance class. So originally they sent 2 staff who were physiotherapists from the local Geraldton Hospital to attend Otago training in Perth. These 2 then developed 4 classes or circuits based on the Otago principle. Balance gym classes were delivered twice per week and are supervised by a team of trained peer volunteers. There is also an at-home exercise program for participants to complement the 2 classes per week. During the initial pilot program, transport to and from the centre was provided for those who were unable to drive or catch public transport. Evaluation following the 12-week pilot program indicated improvements in strength and balance, as well as social benefits reported. Following the program, participants were able to move into mainstream classes as well, therefore allowing new participants to come into the Balanced Gym program. So the program is still running in Geraldton with the same volunteers still supervising the sessions. The WA Centre for Rural Health is also now involved in the program, and it gives their physiotherapy students an opportunity to assist with supervising the sessions and developing their skills while still being students. And a big part of this program was the partnerships between local government, the local hospital, recreation centre and allied health services. Really helped to drive the program, and it was a big part of the program's success. So another case study we're going to look at is the City of Melville, who have the Be Fit for Life program. So the City of Melville first developed a Find Your Exercise inspiration video that can be found up on their website or on their Facebook social media. Through their website, they've also, created a website that's a bit more user-friendly for older adults. They can get on there and search for activities specifically within their area. They also are offering discounted seniors rates at the leisure fit centres, and they've also developed a Fit for Life resource book, which is available for older adults to help them get involved in physical activity as well. The final case study we're going to look at, this wasn't done by a local government, but this is probably an activity that local governments themselves could pick up, and it would be quite relevant for them. So Silver Chain developed a seniors exercise park. The park is located down in Mandurah, and the park was designed to improve strength, balance, coordination and flexibility with the aim of reducing older adults' risk of falling. So I guess it's just a fun way of getting older adults to exercise and something a bit different, just thinking outside the box. Older adults can access this park and have personalised programs developed for them by Silver Chain physiotherapists. So, local government injury data reports. If you're interested in accessing falls data for your local community, please contact the team at No Injury, who are able to provide these local government injury reports. These reports provide information on hospitalisations, fatalities and costs for all injury within your local government area. So if you are interested in delivering a strength and balance program, whether that's at your recreation centre or it might be more of a community-based program, Stay on Your Feet currently have grants available. The aim of the grants program is to, build the capacity of health professionals to be delivering falls prevention programs. So the current theme for this round of grants is Strengthen Your Legs. So it's about encouraging older adults, to build strength in their legs. So grants of up to $5,000 plus GST are available. Grants will need to be delivered within the 3-month campaign timeframe, which is runs from the 1st of September to the 30th of November 2018. The target audiences are non-Aboriginal people aged 60 years and over and Aboriginal people aged 45 years and over. So expressions of interest close 5 p.m. on Friday the 15th of June. If you are interested, please get on the Stay on Your Feet website where you can find more information. The next round of grants after that will be which will be based on the theme Check Your Medicines, and that's for 2019. So recently, the Australian federal government have announced that they will be increasing funding for aged care by $5 billion over the next 5 years. The government will aims to increase levels of physical activities, physical activity in Australians aged 65 years and over and to improve their overall health and wellbeing. A grants program will be established which will support Australians, national sporting organisations and non-government organisations to develop and implement local community-based activities which promote physical activity among older Australians. So programs will be specifically designed for an older age group with 22.9 million has been allocated for the Better Ageing Grants program. So this is a bit of a watch this space for, I guess, over the next year or so to find out more about this great scheme. So that is all from Sonia and I, the presentation for today. But if anyone has any questions about either of the information that we've both presented, please send them through. We'll be available. Well, we've still got quite a bit, about 15 minutes left, so please ask away. So we do have a question from Claudia who has just asked, do you know a contact for No Injury, please? So I will send out some contact details following this webinar with the contact details for both No Injury and I'll send some links out as well for Stay on Your Feet and the Stay on Your Feet grants for those who might be interested in those. Was there any further questions at all? Well, it doesn't look like we have any more questions. We might wrap it up, but if you do have anything that comes to mind over the next day or the next week, please feel free to contact us and we're happy to help you out where we can. So thank you so much for listening in today, and hope you were able to take something away from the information that we presented to you. Thank you.